The following video is comprised of segments of a secret pandemic preparation video titled Road to Pandemic, utilized as part of U.S. government's August 2019 Crimson Contagion pandemic exercises, co-led by Chicago Department of Public Health.
With more than 18,000 cases worldwide, what began as a seemingly innocuous pneumonia outbreak is now an officially declared pandemic influenza outbreak. It is August 12, 2019, and the highly contagious and deadly H7N9 virus continues to pose a threat to all age ranges worldwide.
In late June, our center began testing nasal and throat specimens collected from 2 patients who were hospitalized recently at Tibet People's Hospital with pneumonia. Both of these specimens tested positive for influenza A and negative for H1 and H3, 2 other strains of the influenza virus. By June 23rd, we had identified influenza H7N9 virus in 3 hospitalized patients with severe pneumonia from 2 different Beijing hospitals. We had also identified H7N9 in 2 patients hospitalized at Tibet People's Hospital. We began to conduct field investigations of close contacts of the H7N9 patients alongside our colleagues in Lhasa and Beijing. A day later, we were able to report 5 H7N9 cases with severe pneumonia in Beijing and Tibet to the World Health Organization.
While China's CDC and hospitals throughout China work to treat patients and identify the virus, a 52-year-old male in Chicago who would become the first case of H7N9 in the United States was suffering from what he believed to be a respiratory flu. He was seen at a 24-hour urgent care clinic in Chicago with symptoms including headache, fever, and cough. He was discharged to his home and given medication. This was on June 24th. Not even a day later, the man called 911 and was transported to the emergency room at Northwestern Memorial Hospital in the early morning, where he was admitted with pneumonia. At this same time, 3 of the man's 5 family members were experiencing upper respiratory tract symptoms. On June 26, tests from the Chicago Mail indicated the presence of the virus. Upon receipt and further testing of the sample, the CDC confirmed that this was the first human case of H7N9 in the United States. On July 3rd, 10 additional confirmed H7N9 cases were reported in Chicago. Of the 10 cases, 6 were hospitalized and 2 deaths had occurred. By July 7th, the U.S. Health and Human Service Secretary had declared a public health emergency. For medical workers, this is where the rush to care for and protect populations began. Personal protective equipment, or PPE, was in high demand by healthcare facilities and the general public. And with the start of the school year approaching, many families were terrified to send their children to school. Not only was there an equipment scramble, now vaccines were beginning to be demanded in high volume. By the end of July, 20 countries had reported a total of 6,225 lab-confirmed H7N9 cases to the World Health Organization. Upon the discovery of these global cases, the World Health Organization declared an influenza pandemic, the 2019 H7N9 pandemic. Vaccination for seasonal flu strains were halted due to preliminary investigations suggesting that all ages were susceptible to the 2019 pandemic. Deaths have occurred in all age groups in both previously healthy individuals and persons with pre-existing conditions. No further manufacturing, distribution, or vaccination against seasonal influenza occurred after July 28th. This decision was incredibly concerning to many healthcare workers who work with elderly patients. We'll continue our special report after this commercial break. Welcome back to our SDN special report on the global H7N9 flu crisis. Our story left off in Chicago at the end of July after multiple cases of H7N9 had been confirmed in the United States. Now in mid-August, cases have grown to 12,100 in the United States and more than 18,000 worldwide. The most impacted city is Chicago, with 1,200 cases and an additional 1,300 reported in the state of Illinois. The CDC has recommended to state and local officials to cancel large events. Based on what we know so far, epidemiologists are projecting H7N9 to be much more severe than seasonal influenza, and they are predicting it has the potential to be close to what was reported for the 1918 pandemic. It's remarkable how quickly H7N9 grew from one case in Chicago to more than 12,000 cases spread across the U.S. The Influenza-like Illness Surveillance Network is reporting the following risk levels across the United States. Non-pharmaceutical interventions and treatment continue across the United States, while fear remains at an all-time high. School districts across the country are considering postponing the start of the school year, and absenteeism has gone beyond schoolyards. Across the country, many employees are staying home to stay safe. Currently, absenteeism is highest in the hardest hit states, Illinois, New York, Pennsylvania, and Arizona, with estimates of up to 35% of the workforce impacted by absenteeism over the course of the pandemic. Model forecasts predict that the pandemic may peak in September for most of the country, with an estimated 20 million to 35 million people potentially ill at the peak. Many cities and towns are very concerned about high rates of absenteeism and impacts to water, power, medical facilities, and supply chains as H7N9 sweeps across the country. There are fears of shortages of food, water, gas, and medical supplies if absenteeism grows to the predicted levels. Social distancing and cancellation of large public gatherings are recommended strategies to slow the spread of the H7N9 pandemic. In addition to school closings, sporting events such as baseball and football games may be canceled, as well as other large gatherings. The social distancing strategy will lead to a significant economic impact across the country, but at this point, it is a primary tool to slow the spread of the pandemic. Forecasting into the future, the potential economic impact for this H7N9 pandemic might reach as high as $200 billion for the entire country. Earlier today, we learned that due to the potential for the H7N9 pandemic to overburden healthcare resources in some areas, the president has declared a national emergency under the National Emergencies Act and consistent with Section 1135 of the Social Security Act. Doing so will facilitate further preparedness and response actions as we continue to combat the H7N9 virus. This has been an SDN special report.